Biomedical Sciences, Prashanti. Sir, welcome, sir.
Good morning and Sai Ram to all of you in this august audience. I start offering my most humble salutations and pranams at the divine lotus feet, the divine puppeteer in whose hands all of us are just mere puppets. I've been given a relatively tough topic, not very challenging, not very entertaining, but then I think at least Professor Venkatram is agreeing with me that that is the need of the hour. The way the burgeoning population is invading the planet and nature is finding it really difficult to tolerate. And then just now, Professor Chopraji just mentioned that our treatment strategies have to change from just patient focus. We need to have a broader focus rather than wait for a disease or to appear and then treat the symptoms. We should, I think, now be thinking of how best can we prevent the onset itself. So I go ahead without taking much time. Well, that's about me. Um, Now, why prevention? See, a stage came when the population was less. We could manage with treating individuals. It could have been tribal medicine, voodoo medicine, Ayurveda, or many other traditional systems, and then the modern system of medicine. But as the population increased and the disease spectrum increased, the understanding increased, uh, then people started thinking in terms of various levels of prevention. People talked of primarily it was started off as a secondary prevention, and that's when it started going beyond control, then people start thinking in terms of primary. Then came the tertiary. Then of course partly our doing came the quaternary also. In spite of all that, we see that we are still being submerged at our helplessness at many stages in not able to provide adequate care to a large majority at most parts of the world. That's where the primordial concept came up: prevention or delay emergence of risk factors. Now, cardiovascular disease. Now, as all the esteemed speakers before me have been talking about the various factors happening in cardiovascular disease, I am not going to dwell on that. But it remains a matter of concern, and that it has been a leading cause of death. And governmental efforts have been there, not very strong, but still we haven't been able to reach an even keel. And there was this misconception that it was associated with only prosperity or the high income groups, but that's not the fact. Even low and middle income countries are not spared. So the attitude has to be nip the evil in the bud, prevent at the earliest. Now, see, as I was talking, primordial precedes even primary. That is, you are now focusing or targeting or aborting the risk factor emergence. Now, I know it's not very attractive, economically not very attractive, but if you see from a holistic point of view, from the point of view starting from a community to the nature to the world, it forms the foundation of a lifelong cardiovascular health. And how do we go about it? Now, various models, various inspirations have come up. I'll be covering up the lateral slides, basically targeting lifestyle and social determinants of health. In the next few slides, I'll just rapidly run through that how these have been tried to be targeted and has there been any major impact. Now, how do we go about it? Now, basic thing is our efforts to reduce lifetime cardiovascular risk. Now, if the efforts are successful, it is actually speaking, may not be attractive in the short term, but it's definitely cost effective and sustainable in the long run. Then how does it translate into benefit? There is a qualitative and a quantitative improvement in all indices of an individual, in the family, of the society, and the nation. And primarily, all the esteemed speakers before me have been harping on hypertension, diabetes, obesity. So, with this kind of intervention, can we postpone or maybe even prevent onset of hypertension, diabetes, and obesity? The key factors for the today's day of discussion. Now, I am just touching upon some of the factors which may be affecting it, what we are discussing, the diet. Now, traditionally, if you see, at least if I see my own life, the diet practices of my grandparents changed in my parents' generation. It has again changed in my generation. And in my children's generation, it's totally, now everything is ready-made. You have whether it is an upma or it's a vada or it's a matar paneer, you get a pouch, either dip it in water or keep it in the microwave and it is ready. Two, cultural versus modified diet. Now, it so happened that in about 3 decades back, when I was new in this hospital here, Bhagwan's hospital, uh, for lunch, a Punjabi patient was served rice. And I found everybody had eaten. This fellow had not touched the plate. I asked, क्या हो गया भाई, क्यों नहीं खा रहे हो? He said, डॉक्टर साहब हम साल में 1-2 बार चावल खाते हैं, वो भी कुछ बिरयानी बनता है, अच्छा अच्छा सुगंध वाला चावल रहता है, ये तो चावल हम कभी नहीं खाते. Other way around, a pure thoroughbred Tamil Nadu patient, he is given ragi balls because he is a diabetic. Dr. Iyer has told that no, you give diabetic diet. The first look for him on seeing the ragi ball, it reminded him of elephant dung. How will he eat it? So what I say is, diet prescription one has, see, it holds true for me, it holds true for all of us who are practicing this profession. Kindly, before you prescribe any dogmatic diet, there have been doctors who say, hey, all oils, all fats are poison. You go and have only olive oil. And it costs 1,000 to 1,200 rupees a liter. Majority of the people don't like the smell and taste of it. You give coconut oil to a Bengali, he'll vomit. You give, in my house, if I introduce, at least for my parents, if I introduce mustard oil, they'll leave the house and go. So that is where I am telling that cultural practices as regards fat consumption, even the content of food, how food is eaten, all these matters. Unfortunately, all those things with the so-called economic growth, as Professor Mohan was discussing yesterday, that economic boom which came after 91 and how it saw the emergence of increase in the incidence of diabetes. I'll dwell on it in a little later, how it is true, it's not wrong. The other thing is fertilizers and pesticides. Now, this has become such a big curse. Most of you would have been aware of the endosulfan tragedy in the Kerala and many others. Now, do we have any solution for it? Unfortunately, no. I get to know that apparently in the state of Sikkim, you have a so-called promotion of pure organic food materials. I wish I could be resident of that state. We don't have the luxury here. 2, 3. Now processed foods have become the role. There was this practice in my childhood of the father getting wheat, mother will wash it 3 times in water, sun dry it, I'll be asked to go to the mill, powder it, she will not sieve it, and the roti will be made out of that. It used to be a bit hard. But now people have the Pillsbury and Kisan and what other things. It is just super refined flour. Where are the fibers? 3, preserved and processed food, as I told you. My wife has never touched a grinding stone. There is either mixer, grinder, sometimes even that is not there. You have a ready-made dosha, idli, everything is there. Now, what all goes into preserving that, I think even that Lord sitting there may not know. And what it is doing to our body, nobody knows. Even our esteemed Chopraji and Venkatramji, even if they break their heads, they may not be able to find out what it is doing to the system. 4, calorie consumption mismatch. Here I'll share you. As a childhood, I lived in the north. We had this Akhada people. They'll do 500 buttocks and 500 with mudgal and all, and they'll eat only 25 eggs for breakfast. Till this, and there will be a kg or two of chicken and some 12 parathas for lunch. Till 30, 35, they'll do that, and they'll do their what they call varjish, if I use the correct word. From 35 to 40, that varjish comes down, intake doesn't come down. By 40, they are horrible diabetics, hypertensive. By 42, they are already gone. So this is true for all of us. And I think the culprit starts right from childhood. The mother is not happy if the child is not eating. She will hold the hands, the legs, pinch the nose, and shove the food in. The wife is not happy if you don't eat what she's serving. See, I think you don't like my food. You only like who eat hotel food. So keep her happy, you gorge in. This calorie consumption mismatch is another big curse. Exercise. Now, as I don't know, culturally, I think exercise as a concept is almost absent in our culture. In South India, if you talk of exercise, what exercise? We go to the temple, no, we do 3 pradakshina, that is our exercise. In North, even that is not there. So now with so much of automation, practically physical exertion has come to a nil. I remember my grandmother's era where when she used to dishwash, she used to wash her clothes, she used to grind that idli and dosa for 10 people in the house. That was enough to keep her fit, her joints fit, and no arthritis, no hypercholesterolemia, no diabetes, no hypertension. Where is it that today? Automation in the same concept. Everything is automatic. To the extent that nowadays, I'm sorry to use, go to the toilet, you just need to sit and press a button, everything else will be done. Even that you don't want to make efforts. So sorry is the state of affairs. Cultural bias, I just mentioned. See, cultural bias, here in this hospital, we get patients from all over the country. Now, I usually was at Loggerheads, the dietary department. Please, you consider the patient's culturally oriented diet. As a doctor, I'll write, okay, 1200 calories, diabetic, low salt, low fat diet. That doesn't mean you'll have one size fit all for everybody. All of this is definitely affecting whether we acknowledge or not. Rest and sleep. Where is rest and sleep? The days I get 4.5 to 5 hours of undisturbed sleep, first thing is I get up and thank Swami. Oh, tonight at least you are kind on me. The biggest enemy which has come is that all of us are carrying in the pocket. Swami used to show like this. Mobile phone. Your pockets may be empty. No need to carry wallet also, that is enough. And that won't allow you to sleep. Stress management. Now, stress, as you said, as all of us know, it is stress. The moment the baby comes out of the mother's womb and takes the first breath, stress starts. That is the truth. It is truth. The stress starts from that time. Till 9 months, it was in the cozy environment of the mother's womb, and it comes out and it sees monkeys like you and me, and we are handling him, holding it upside down, giving a spank on the buttocks. And then he says, what is this here? All these 9 months I enjoyed, and what is this? Stress starts there. Question is, stress has to be there. If there is no stress, we will all be dead. It is a question of how you respond and not react. But that is where, as my esteemed professors before me have been talking about how our Bhagwan's attitude and approach, how it actually makes or changes or orients our approach. That's why many people ask me, hey, how come have you survived here for 3 decades? I said, there is one extra bonus I get here, which I won't get in anywhere else in the world. That is spiritual enlightenment. It changes. I'll be seeing the same patients anywhere else in the world. But my approach and response to the patient, that gets colored by what Bhagwan has been teaching and telling. That is the biggest difference. Substance abuse, dependence, no need to say. Obesity. There was a time in my childhood, I remember my grandparents will telling, oh, if a man is obese, oh, he is prosperous. Today we say that it is a curse. Nice obese child, अरे खाता पीते घर का है. Now WHO says childhood obesity is a big disease. hypertension, diabetes, dyslipidemia. I have forgotten the smell and taste of what they call deshi ghee. Now, our professors before talked of environmental pollution, air, water, cosmic radiation, all of which, yes, is taking the hot toll. What are we doing about it? Are we able to do anything about it? No. 3 decades back, when I came back here, Puttaparthi was one quaint, beautiful, peaceful, clean hamlet. In spite of being a drought-prone area, there was greenery around. 1995, Bhagwan's 70th birthday onwards, we started seeing the concrete jungles going. Now the greenery has disappeared. No town planning, nothing. This is how it has been taking place all over. Economic disparities. The way it is, and it is, I think, a fact for all over the world. And of course, so changing social and cultural milieu. All of us, many of us, for our livelihood and for various reasons, once we migrate, we go elsewhere. We don't have our own rooted in our culture practices. Now, what at all is there a solution? Health promotion practices, why? Policies and control of processed and junk foods, wishful thinking, afforestation. Yes, one day in a year we have that one vibha coming and cutting this thing, that's all. Food fortification. Now I think shortly we will need, like in the US, fortification of our Pillsbury atta with some bran, so that you next day you don't suffer from colonic cancer after eating that. Legislative control on tobacco and alcohol. During peak of COVID, one particular state relaxed for 1 week alcohol for an important festival celebration. 3 kilometer long queues were shown, and the 1 week collection of revenue for the state was 600 crores. Kindly understand. Stringent laws to prevent environmental degradation. They are on paper, not at all. Now, as I said, cultural versus cultivated food habits, vegetarian versus non-vegetarian, unprocessed, naturally processed, and artificially processed foods. All of this I have talked. Exercise, weight management, sleep hygiene, stress busters, spiritualization. Spiritualization, people ask, how do you define it? Now, is there a small, tiny ray of hope, a light at the end of the tunnel? Political will. Where is the political will? I don't know. At least I find it lacking in this country. Now, school-based, workplace-based, community interventions, they do work. But to what extent are we able to really capitalize on it? Many non-profit agencies, they could possibly play a role. Religious leaders, because they have a say on, or rather a sway on the people, maybe they can make a change. Now, in passing, I want to mention, Professor Narulaji will agree with me, the North Karelia project of Finland, which I would say it was one of the first which really brought about that community-based interventions do make a significant change. And this was actually, I would say it was a pilot project, and it has proved. And I think this should be a benchmark for all of us to follow in the world, throughout the world. See, it's basically community-based intervention in reduction of cardiovascular diseases. Very small, very minor. All they noticed was there was a large burden of death in the middle-aged population due to cardiovascular diseases. They targeted cholesterol management, BP control, and smoking cessation. Involved the local population in planning implementation, and in the 5 years they themselves were surprised. And started in 1972. By the time it was 2014, the death rate due to cardiovascular diseases had become 1/3 of what it was in 1972. Then it got adopted as a national policy. Now, why can't it be replicated elsewhere in every part of the world? As I mentioned, impediments to remedial measures, very difficult. Lack of political will. Again, you and I don't have any control. Resource limitations, yes. And a stiff resistance to change. I have been doing that. My grandfather has been doing that. I don't want to change. The biggest, even 30 years back, in this remote village, you go to a shop, you'll get that packet of Maggi noodles. MNC invasion and promotion and sale of unhealthy junk and processed food. That is where we are come to. Now, what will be the carry home message? Primordial prevention should be part of the WHO advisory and made mandatory across the world. Collaborative initiatives between nations, religious, cultural, and political leaders. Use of digital technology, yes, that is a boon for dissemination of information and awareness, and robust legislation and mandatory policies. Now, it is the urgent need of the hour for all NCDs. Results are not instant, but it is cost-effective long-term strategy. It's a multi-pronged approach needed with legislative, community-based, and healthcare-based collaboration. The only answer for reducing global burden of not only cardiovascular diseases, but a host of other non-communicable diseases. I wrap up my text with the universal eternal message to the world from Bhagwan Sri Sathya Sai Baba. His popular slogan, Hari Vari Kari, aptly covers all the risk factors for CVD. His earnest appeal through various discourses on purity of food, cessation of vices, sealing on desires, and emphasis on spiritualization of life is affirmation of the fourth point in the WHO definition of health. I end it with profound respects to the universal Messiah, mentor, and motivator, Bhagavan Sri Sathya Sai Baba. I beg your pardon. I'll need 2 more minutes more. Otherwise, I'll be failing in my duty because of my fourth decade of association with this institution, of which almost first 2 decades I had kind of personal association with Bhagavan himself when he was physically present. So when this was conceptualized, it was really, we were all, and there were a series of meetings, and Professor Akshay and our Professor Krishna Raoji and all of us brainstormed. And I think in all earnest, when it was decided that we should get the World Heart Federation to celebrate its 25th so-called birthday and Bhagwan's 100th year of advent, people thought it was wishful thinking. Nobody ever imagined that it could ever take place. And to place on record, I wish to, on behalf of all of us here, profound thanks to Professor Jagat Norula for being kind enough to accept our invitation and choose Puttaparthi as the destination for the 25th birthday celebration of the World Health Federation. And I submit my prayer, as my previous speakers have said, that hopefully the 50th or the Golden Jubilee celebrations of World Health Federation should also be held here. I agree. Many of us may be in the ethereal plane, but we can enjoy watching from there. So my profound thanks once again to Professor Narula. A big hand to him, please. I will be failing in my duty if I don't mention the role of Dr. Krishna Rao. From the time the first meeting started, he has been eating, living, breathing, sleeping with only this conference. I think his computer and his phone must be only full of messages being sent to so many places, coordinating so many things. I used to wonder, he has only one brain, 2 hands, and 2 legs. How is he managing? But a real, true, silent worker. And if all of this, what you're seeing today, has really transformed into reality and is a thundering success, he receives a standing applause. Dr. Krishna Rao, please all of us give him. He, for the last 10 days with family, he is camping as if it's his own personal daughter's marriage. That is the dedication of Dr. Krishna Rao. Now, when the deliberations were going on, what all should we do? This concept of hard work and what all things took place. A sudden brilliant idea of an exhibition came. And it was debated upon. One person whom I call that person pocket-sized nuclear bomb, came up with that suggestion. I'm very honest, I was a little worried. Possibly I'm in the wrong side of age to think and to work for it. But Krishna Rao sir was excited. He said, we'll go about it. That person single-handed coordinated everything, right from contacting, talking, meeting the school, college, institution, inspiring, and you see the wonderful result. You saw the exhibition. Yesterday, somebody mentioned that some doctor mentioned had it been given, the same project been given to MBBS students, they wouldn't have come out with just such beautiful. I myself can state school children, 7th class, 8th class, so beautifully they're explaining concepts which we didn't understand even in the first year of medical school. And majority of them haven't even seen Sathya Sai Baba in flesh and blood. So imagine how much is the inspiration which has really goaded them to bring this. I was really disheartened when I came to know that today 3 p.m. the exhibition will be closed. I make this an appeal to all of you by whichever way you can influence. I see as a commemoration for Bhagwan's 100th birthday, at least till the birthday, if the thing can be retained, every visitor should have a look at it. And if wishes were horses, definitely beggar like me will also ride it. I would want that it should be preserved for posterity. The 50th anniversary, when they come, they should be able to see that, yes, this was what was present 25 years back for the 25th anniversary of World Heart Federation. So again, I request all of you one final standing ovation for those great students and their teachers and mentors for the wonderful job they have done. And one more, please don't sit. One more standing applause for that. I told pocket size nuclear power. I didn't tell you who it was. Dr. Vidya, she's a dynamite. I sometimes wonder where she gets the energy. Doing a tightrope walk, she managed clinical duties, and she did all of this. And I'll be feeling guilty and failing in my duty if she doesn't get a good thundering round of applause. We'll see. Lastly, when I saw the last 2 days, I saw this, there was a tinge of regret. Had Bhagwan been around physically, I think he would have been the most happiest person. This is my personal contention, having known Bhagwan so intimately. But still, in the ethereal form, wherever he is, he definitely has seen supervising all of us. And the very success of this program is his. And his able successor, the current who is carrying on his shoulders the burden of the Sathya Sai kingdom, our honorable uh, managing trustee, Sri Ratnakarji. I think we should all be thankful to him that despite the Navaratri celebrations going on, he became bold enough that we should allow this to happen. So a big thanks to him and one round of applause. And being the sacred 9-day festival of the Holy Divine Mother, I thank all of you and end up with Jai Sai Ma.
Thank you, Dr. Iyer, sir, for your